Hi guys, welcome back to my channel, and as promised in this video I'm going to be talking about a hospital experience, my last hospital experience actually. So I went to dialysis one Wednesday I think it was, and somehow when I was on the machine I just was not feeling good. And I remember Nurse Blacks asking me, is it that I have a headache? Is it that she was just trying to figure out what was wrong with me. Thank you so much, Cherise, for your concern. I really appreciated that. I could not place what I was feeling at the time. I really didn't know. It's not that I was in pain. It's not that I had any shortness of breath. I just knew I felt unwell, but I could not actually describe what I was feeling. And I asked them to stop the dialysis session, and she asked me if I wanted to go to the hospital, and I said no. And so I remember I called Geddes because at the time, because of the surges on my hands and just how bad they were, I still wasn't driving at the time, right? This is 2021, December. So I called Geddes and I asked Geddes to come and pick me up because he would have to get up in the mornings. I was still working at TTT, drop me for work for 5 a.m., come back down the road, drop Auntie Allison to work, his wife, come back down the road, go back for Auntie Allison, come back down the road, then come and pick me up from dialysis or work, whichever day it was. Geddes, thank you. I knew that was not easy either. So yeah, Geddes came and picked me up, but by the time Geddes came, I was in severe pain, the right side of my back. When I tell you pain, I sat down in the car. I couldn't have a conversation with Geddes. I'm writhing in pain. I'm moving left. I'm moving right. I can't find a comfortable position. I'm bending over. I'm trying to sit up. I'm putting my head back. I was in severe distress. Geddes again asked me if I wanted to go to the hospital. Now this is 6 months post left hand surgery and 3 months post right hand surgery. I did not want to go to the hospital. I am sure that there may be dialysis patients who die after having some traumatic experience in the hospital, and against their better judgment refuse to go to the hospital and probably lost their lives. I was in that position in December 2021. I came home. I told Geddes to go for Auntie Allison because I wasn't feeling well enough, and I did not trust myself to be here by myself. I mean, by the time I'm in here, I'm bawling loud. I'm not even a loud crier, but I was like, why? I was in pain that I thought I couldn't even describe. You hear me tell you? And by the time Auntie Allison came, she asked me if I wanted some tea. I said yes, but then I started feeling nauseous. And with the nausea, then I started feeling like I wanted to throw up. So Auntie Allison was like, no, I'm going to call the ambulance. I was like, no, I'm feeling better. I'll take the tea and I'll feel better. That's what trauma does to you. When you're traumatized by an experience, it clouds your judgment. Because looking back, under no circumstances should I have refused to go to the hospital. And I refused that bid until Auntie Allison took the decision out of my hands. Thank you, Auntie Allison. I just refused to go to that hospital because that hospital had become a place for me that I could not trust, and I wasn't going to get the best care. That's what the hospital has become for me, This place that I fear totally and completely. It's no longer a place that I go to where I know I'm going to go in and I'm going to come out better than I went in. And I've had those experiences too, but I've had so many bad experiences in the hospitals since I've been here. I've had good, I've had bad, and really and truly maybe it's about a 50-50 or a 60-40, 60 towards good, 40 towards bad, but my odds in my head are just not good. So I just don't want to go there. So I refused. I decided, okay, I'll try to take a bath. And I literally had to sit down on a chair. I could not even stand up in the shower. I was so weak. And remember, the hands were still not functional, very dysfunctional even at that point. So a bath for me was still a task. But here I was feeling so weak, feeling so nauseous, vomiting, in severe pain, and trying to take a bath. And these are the things that can happen to dialysis patients that you'll never hear about unless people like us choose to share our testimonies. So I went, I tried to get a little bath. I came out. After a while, I was feeling a little bit better. The pain had eased up just a little bit. And, I was sitting there, just kind of rocking, still feeling nauseous, but, just there kind of rocking myself, trying to tell myself that I'll be okay. But I just was not functional. And so Auntie Allison decided to call the ambulance. Of course, by the time going down the road, I had a pillow because, I'm in pain. I'm just not feeling comfortable. And we went to Shoguana's health facility. When we got to Shoguana's health facility, it's a long line. Hear me tell you. Like A&E was full that day. And they were asking me, because I'm coming in with symptoms of vomiting and nauseousness, to go and get a COVID test. And that line was long too. So Auntie Alice was like, no, the state that I was in, she did not trust that. So she said, Geddes, we cannot stay here, because I think she wasn't willing to risk anything further, anything worse happening to me, standing there trying to get help. I couldn't even stand up at that point. Let's be realistic. Geddes had to help me down the stairs and into the vehicle. I was not able to sustain myself at that point. So they took me to medical associates. And when I got to medical associates, of course, their policy is you can't come inside unless you've done a COVID test. They have to do the test. And you have to pay cash. And the cost of the test was either somewhere between $600 to $700. Lucky thing I had little money in my purse. If you all know, you know that was a miracle. It's almost like there was some foresight that I was going to get sick, and therefore I had money to pay for the COVID test. Because I don't ever have more than a $35, Not because I don't want to walk with money, but because normally I don't have enough to walk with. You understand? Anyways, that's a discussion for another time. So I had to sit outside, do the test, wait for the results. If you all know this test is intrusive. It's very uncomfortable because they're taking these very long, about that length, Q-tips, and they're pushing it up your nose, and it's going all the way back, almost to the back of your throat. But it doesn't feel like it's in your throat, It feels like it's in your brain. That's literally how it feels. And as somebody who has done over 15 COVID tests, I think I'm in a position to talk. Right? So I had to be out there. Then they took me inside into a room. I'm still nauseous. I'm still throwing up. And I can't remember doing the CT scan, but I do know that I got a CT. Is it a CT scan, the one that you do with the dye? And they did not do the color dye. They did black and white, like a black and white contrast, because I'm a dialysis patient and I had just come out of dialysis. And thank you to medical associates. I don't know if they didn't want to take any kind of risk, or not knowing when I was going to get dialysis again. They did the dye. They did the CT scan without the dye, because the contrast is something that you don't want. They call it the contrast, the dye. It's something that you don't want to keep in your body as a dialysis patient. And when you're sick, you never know when you're going to get dialysis. So you never know. I'm telling you from my experience. You could be in that hospital and you have to be asking them doctors, am I on the dialysis list? Are you sending me, in Port of Spain General, are you sending me for dialysis? There's never any guarantee, I don't even know how, after so many years of having a healthcare system, that you still have to be going through this stress of being a dialysis patient and being uncertain about whether or not you're going to get dialysis in the hospital. My experiences, not experience, experiences in Port of Spain General. So I'm at medical associates. I do remember them putting a tube down to my stomach. I can't remember if it was through my nose. I think it was through my nostril and not through my mouth. And just for me to bring up all this bile, because as this time I'm vomiting blue, I'm vomiting green, I'm vomiting brown, and the pain. And what they told me is that it seems as if I have is it at medical associates that I learned that? Let me pause. But anyways, I was in medical associates. They ran some tests. I was in medical associates. I honestly can't remember for how many hours, but all I remember is Auntie Alison and Geddes making the decision When I left, when I had to leave Medical Associates to go to the hospital, because Medical Associates recommended that I go to the hospital, that they drove me to the hospital because of the cost of the ambulance. Because by the time I came out of Medical Associates, my bill was close to $7,000 or $8,000, right? For whatever transpired in there. My bill was either $7,000 or $8,000 for whatever hours I was in there. I'm positive I went there sometime in the night, maybe like after 7 or after 6, and by early the following morning, I was in Port of Spain General. I can't tell you what time I got to Port of Spain General. I just wasn't very functional, just not very aware of myself because I'm so weak. I just don't have the energy to be checking time and to be checking this and to be checking that. And I remember being in the hospital and being without a mask and thinking to myself, panicking in there and thinking, oh God, even though I've tested COVID negative, what if I come here now and I come and catch COVID? Because I'm throwing up so much, putting on a mask on me doesn't make any sense. And I'm so nauseous that even when nothing comes up, I'm still heaving. And I'm in Port of Spain. I spent the night in accident and emergency. I know that because I remember the following morning getting up and needing to use the bathroom and needing help because I couldn't even go to the bathroom by myself. Of course, they offered a bedpan, but of course I said no. Let me tell you something. You can't have any shame when you're sick. You don't even know half of the things that happen to you when you're sick. And when I say sick, I don't mean you have a cold. I mean when you're sick. You understand, as I was. And the following day, I was warded. And what I remember of the experience is, one, when you're in a hospital and you're short-staffed, as they were when in December 2021 when I was there, you don't get the best care. I remember being there, asking a nurse who to me was the only nurse doing the rounds that night, I can't remember her name, and seeking her attention, and she literally almost barking at me to tell me she has this patient to attend to and that patient to attend to, and I have to wait. And then later on in the day, when it's daylight now and stuff, and like about 7, 8 o'clock, and she came and she was doing my vitals and stuff about 7 o'clock, because they do vitals very early. Whatever time it was very early. And asking me, my blood pressure was very, very high. And she was asking me, you know, she was like I think my memory of the conversation is, you know, I'm telling her I'm in a lot of pain, and this woman going to come and ask me why I didn't call for help. And I was like, but I call you, you tell me you're seeing to other people. I didn't speak to her like that, but that's what was going on in my head, like something has to be fundamentally wrong. But when they're short-staffed, these are the things that happen. You're not a priority when the person who is beside you has to be suctioned every couple of hours and has to be turned, and you're not a priority. Remember, whether or not they want to tell you, you are triaged in the system. You are triaged in the system, which means they're going to put you in a rank based on what is happening with you. It's the same thing in A and E. You're triaged, right? So if you come in and you have a gunshot wound, you're going to take precedent over the person who comes in with a headache. Even though that headache could be an aneurysm, they don't know, but they know that a gunshot wound needs attending to right now. That's the system that we're working. That's the system we have to survive in. That's why I always say, take care of your damn self, because it's best to take care of yourself than you'll be battling with the system. Because the system might be doing the best it can, but it doesn't mean that it's going to meet the threshold of the care that you need, right? That's the reality. So I am on this ward, and different doctors are coming to see me. The nephrology team came, and they're telling me that it seems that I have some cyst on my right kidney that ruptured, and it caused some bleeding, and that's what caused all this nausea and vomiting and this weakness and all of this. And at that hospital visit, it had another team that came, and they were suggesting that I could do a surgery to remove the kidney, but that's a huge surgery because they can't guarantee that I won't grow cyst on my kidneys again and that it won't rupture again. And when you have a cyst on your kidneys that ruptured, what happened with me is that my blood count went down to 3.6, right? because I'm bleeding internally. My blood count went down to 3.6. And so I had to have blood transfusions for a kidney that, for these same kidneys that not working, right? Yes, they can still cause you problems. And so I had to have blood transfusions. I was on drip all the time. And then there's this age-old issue with a lot of dialysis patients where your veins get so small that they can't find a vein to put an IV access in. So I ended up getting a small catheter in my left groin, very similar to a dialysis catheter. Matter of fact, might be the same, just a smaller version. So that every time they needed blood, they could draw blood, because they were constantly testing my blood to see what my blood count was. If it was going up, because they could not release me until, they could not send me home until my blood count was back up. So I was in that hospital, and of course that was the hospital visit that when they eventually took me downstairs for dialysis, that catheter that I had in my groin that had ended up giving me deep vein thrombosis because it wasn't placed properly, right? They had to take it out and give me a dialysis catheter here because it had stopped working. But since it went in April 2021, it was a battle between April 2021 to December 2021 to get that catheter to pull properly. It just was not placed correctly, long and short of it. And that's what gave me deep vein thrombosis. And yet here I was in this hospital, and these doctors are telling me to ensure that the clot doesn't travel, I can do a surgery where they place a mesh up in my groin to ensure that the blood clot does not travel. When I tell you don't get sick, I mean don't get sick, because you can't even begin to appreciate or understand the kind of complications you can end up with just being on dialysis. Because I went on dialysis, okay, I may have my one good catheter, okay, you take it out, you tell me a graft is better. The graft only worked for 2 years, then the graft failed. Then I ended up trying to removing the graft. You leave a piece of graft in my hand. That surgery ended up in severe nerve damage. You decide that I needed a catheter, a dialysis access still that was better than the catheter. That was in my groin. So you try to create another graft or fistula on this hand, which they say, the fistula they say is the best. That ended up in severe nerve damage as well. And here I was with a catheter in my groin that wasn't working properly and needed surgery again to remove that and to put a catheter on my chest, which is what I have now. And after all of these surgeries and all of these botched surgeries, you come in to tell me to do a surgery, one, to remove that kidney. But you know what? I appreciate those doctors, because they told me the risks up front and told me that it's not a surgery that they would necessarily want to take the risk to do, because the risk is high and there aren't any, and I appreciated that. Of course, I said no. Why? I've had too many fucking traumatic surgery stories. So I said no. And to the one to prevent the clot from traveling, I took the decision, and this is what happens when you're traumatized and when you're not guaranteed of the outcome. I took the decision not to do that surgery either, and to take my chances with this clot in my leg. I don't know if it's going to travel. To this day, I don't know if it's going to travel. But what am I going to do? Go and do another surgery? Go and do another surgery where I don't even know what is going to happen in that surgery. And guess who's going to do the surgery? That surgery to place that mesh. The same doctors that did the surgeries on my hands. Now, either these doctors think I'm wicked to myself, or they think that I don't have any feelings, or I don't understand trauma, or I'm so strong that, or I'm so reliant on them that I'm just going to leave everything up to them regardless of the outcome. My outcomes have been bad. Why would I want to volunteer to put myself in there again? So I said no. And I spent 11 days in that hospital until my blood count was up to 6, and until my calcium levels were normalized again and all of that, before they were able to send me home. And when I came home, I could walk, but I had zero energy. So if you all remember, when I was at TTT in December for about a week or stuff, I was doing the show from home. And even TTT. TTT see me just come out of the hospital. Me did how many what you call it? COVID testing there. But because I came out with a cough, I had a little cough. They didn't want me on the show, which I understand. There's no need to put anybody at risk. But oh God, I did tests not only at Medical Associates, but also at Port Spain General. I'm telling you, I've done about 15 COVID tests between 2020 to now, and I haven't done any in the last year. So all of them were between 2020 to 2022. Yeah. So that's the experience that I had, and I just wanted to share it with you to ensure that you have doctors who are in your corners, and don't be afraid to ask questions. And remember that a doctor is trained a particular way, and so they're going to be making recommendations based on what they know. It doesn't mean that the recommendation is automatically wrong. It also doesn't mean that it's automatically right. And it would be nice if you have a general practitioner who you can, bounce things off of, so that you can get some feedback outside of what you're hearing there. I think that is so critical and so important, so that you can make the best decision for you. And you will never know what the best decision is for you unless you have sufficient knowledge. So that's a hospitalization experience I wanted to share. It was a very rough one, but man, it had some nurses on that ward upstairs. Upstairs, the dialysis unit in Port Spain General, that old building, heading around to Costard, heading around to the back car park. That building upstairs, I think it was the last ward upstairs, the last ward on the end. I think it was the last one. I can't remember. It's one of those 30s, somewhere in the 30s. I can't remember if it's 32, 33, 34, but one of those wards. It has some amazing nurses on that ward. So even the nurse who didn't attend to me the night, even though I was in so much discomfort, I don't have an issue with her, because she too was under a lot of pressure. And you have to give way for these things. You have to understand that even though you are in a bad predicament, sometimes so too are the nurses. The nursing shortage, the staff shortage is real in the hospitals, Regardless of what Minister Terence Singh has to say, my experience is that there are shortages in the hospital, because I've experienced it. And that was just one of the experiences. And matter of fact, my last experience, because that was the last time I was in the hospital, December 2021. So I wanted to share it with you just to encourage you to get a second opinion. And that you have to understand that not all doctors and nurses are created equal. You are going to find nurses and doctors who are very much invested in your care, and you're going to find those who just go through the procedure. Whether you live or you're dead is irrelevant to them. And I mean this, because at the end of the day, they are seeing 10, 15, 20 people, and they might be overwhelmed, and they're just doing what they're tasked to do. Right? We have both who exist in the system, and it's for you to know the difference between them. And I have learned over the years the doctors who really look out for me and the ones who don't. It had this doctor who was there, he wasn't a nephrologist. I think he was from internal medicine. Was his name Brown? A tall, slim, dark guy. And he was so invested in my care. Thank you to him. Can't remember his name. Listen, I tell you, I can't remember half of people name these days, but I guess maybe that's just old age, or because you interact with so many people, it becomes difficult. But thank you so much for listening, and find that person, find that doctor who is invested in your care. Don't assume that all of them are or all of them aren't, but make sure that you know where you stand, and make sure that you have a doctor who you know you can trust and rely on. I remember when I had to do my parathyroidectomy, which was to remove my parathyroid glands. It should have been 4, it ended up being 2. Don't ask me why. And there was an anesthesiologist in there, Dr. Elcock. And I remember her name because she was so considerate of me. Thank you so much, Dr. Elcock. And it was particularly touching because, if my memory serves me correctly, at the time when I had to do surgery, she had just lost a sister. She had a death in her family, and she still came and she still did the best that she could do for me. Them doctors, the ones who's supposed to be getting hummingbird gold and silver and bronze and Shakonia, this and that, Them the people, you see them doctors who sit and go above and beyond, or even just meet the threshold of good care, they should be rewarded. So thank you so much. And in my next video, I'm going to be talking to some of these doctors, because I just have to tell some of them what my experiences have been and where I think they can do better. Have a great day, guys. Bye-bye.